What's up everyone? In today's video we are going to be discussing what it is like treating patients on a detox unit in a psychiatric hospital as an RN. Before I go any further, please like and subscribe to the channel. Let's jump right on into it. So what I really want to discuss when it comes to this video is what it is like from my perspective as an RN, what it is like treating somebody going through alcohol withdrawal, meth withdrawal, benzo withdrawal, fentanyl withdrawal, opioid withdrawal, what it is like on my end being an RN who works on a unit like this. And today we're gonna primarily be focusing on, and really all we'll be focusing on, it'll be a short video, we're gonna be discussing alcohol withdrawal. And I'm gonna hit on DTs, which are delirium tremens, which are something that you have to be very careful with when you're monitoring somebody who is actively detoxing, and in particular, typically older in age, anywhere from really 40s to 60s. You see it a lot. You don't see it in younger people, but it can happen. So let's just go ahead and jump right on into it. So when I'm coming in to my shift, a lot of times I get my report and I'll have a lot of patients on CWA, and that is the tool we use to assess a patient going through alcohol detox. So a lot of times I'll have 4 or 5 patients on a CWA. I'll have some other patients on different types of assessments depending on what they're going through, but I'll have 4 or 5 that are on a CWA. And typically from there, the first thing I always ask the nurse giving me a report is severity. And just kind of like if they are, for example, let's say they're saying, last night and they've been detoxing for, let's say, 48 hours, they started seeing creepy crawly things, or they're more paranoid, or they're even hallucinating. Typically what I would do from there is I would ask what right now is the blood pressure, what are the vital signs, and if we don't have a up-to-date one, we go do that. So my whole point of introducing it this way too is that how I go into a shift is priority. In any, you'll learn, and if you are an RN, I'm sure you're thinking this because they drilled in our head in nursing school, but even when you're practicing, priorities. So in a report, that's really my main intention is tell me background, but if there's something going on, tell me about it. So let's go ahead and jump right into it. So somebody who's detoxing from alcohol. Big question first is, how much have you been drinking? How much have you been drinking? Also, what kind of alcohol? Is it beer? Is it hard liquor? Obviously, liquor has a lot higher alcohol content than beer, but common questions. So typically, when somebody has been drinking for an excessive amount of time, and for everyone it's slightly different. Typically for younger, anyone below 40 in my opinion, or you can even throw maybe 50 if they're in good health. If they're detoxing, typically their detox will be a little bit easier than somebody a little bit older. Not all the time, it can be worse, but typically just due to even metabolism, your overall organ function, what is your health history, meaning do you have any coexisting conditions with it, like diabetes, high blood pressure, you name it. But typically, if you're younger and you're going through this, that's why it's a little bit easier for you. So typically, first off, everything I'm telling you, I'm just an RN, I'm educating. I can't give you exact answers if you're asking questions specifically on your treatment plan and whatnot, or if you're trying to quit, but I can just educate. I am going to become a nurse practitioner though, I will say that. Now, that's off topic, but really, I would say if somebody comes in and let's say they said they've been drinking for, let's say, I'm just giving off of kind of what I see, a year, or even, let's just start with a year. They'd be put on a CWA protocol. We're really assessing, we're having them, put your hands out for me, shakes, how much are they shaking? You have to be careful with that though, because a lot of times people will fake the shakes, so a lot of times you just have to observe when you're doing your CWA. But are there shakes? Are they making sense? Do they know where they are? Are they disoriented? Are you having actually to go to their room to ask them questions? That's a big thing. A lot of times if they're not coming up to get their meds, and they're in the room, you can, a lot of times it's because they're detoxing hard. There's people who will come up and get their meds who are detoxing hard, but that's still a telltale sign. That means physically, mobility, they're moving, they are going to MedPass to get their meds, meaning they have an idea of what they need. They might not know where they are, hopefully they do, but they at least, they're essentially putting effort in, and they're using more cognition. Now, typically for treatment, now, never cold turkey it, obviously. That's why I will say that, because you can't have seizures, but from what I see in the inpatient setting, a lot of times is they'll come in, sometimes even drunk, actually a lot of times drunk, and typically the first 24 hours to 48, if they just drank when they came in, they're not detoxing super hard. Now, if somebody's come in and they're already, it's been a day and they're detoxing and whatnot, that's different. That's a little bit different. But typically, if we know they're going to go through detox, they drank that morning before coming in, that night, that the first thing we do when they hit the floor, a lot of times, depending on it, a treatment that a lot of people get primarily, and this is where I live, is Ativan. Even though it's a little bit more short acting, sometimes Librium will be used depending on the situation. But Ativan it's a very good one to use because you can use so much of it. It's used for seizures as well. Overdosing on it is very tough, very tough. Ativan is given, once again, Librium. But another thing I really wanted to go over is phenobarbital sometimes, but that's a med that's not used that often. If a patient's prescribed it before coming in, yeah, they can use it. But big point to this though is, we're giving them these medications, and let's say 48 hours has passed and they're detoxing, they know where they are, they're doing okay. You know, I have my shift for the day, I've been doing their CWA, they've been getting their medications, they're eating some. And this, once again, I'm just focusing on alcohol in this video. Let's say I go home for the night, I come back the next day, and then I get a report saying the patient overnight they switched, meaning now they're hallucinating, and more so even than that, one thing I will say is it's the disorientation, which can be very scary. So a lot of times when that starts happening, I mean, we really have to monitor them because they're more of a fall risk as well. But if there's a sudden change in them, it can be DTs, but delirium tremens. But I will say though, a lot of times with this, it'll be assumed that that's what's going on, or we need to, for example, we have to send them out via ambulance to get more treatment. But a lot of times what some people miss is, and I know it might sound basic, is getting a set of vital signs. A lot of times, one of the differences between let's just say, psychosis, hallucinations, and DTs is that with DTs, there will be changes in blood pressure. And what I mean by that is super high heart rate, super high blood pressure, or I'm not even going to say super high, but from what their baseline blood pressures have been, even when detoxing, any extreme changes, their blood pressure could actually be could be normal still, but their heart rate could be up to 150. So those are big changes. So if let's say their vitals are normal and whatnot, you need to monitor them, encourage them to drink fluids. If they're hallucinating and whatnot, sometimes they'll give them something like a Haldol or Zyprexa, or even another thing we'll do, that is common prescribed, once again, Zyprexa, Haldol. Sometimes if they're needing sleep and not getting that, and they're throwing up and having nausea, a shot of Phenergan will really help. It'll help them sleep, it helps with nausea and vomiting as well. So this is kind of what it's like. I would say what it's like for me to work in the psych setting, some of the things I'm looking at, but I really hope you learned something in regards to what it's like to detox from alcohol, and also what DTs are, which are delirium tremens, because they are very important to monitor for. And in the next video, I will be covering specifically what it's like for me to see somebody go through meth withdrawal and what it's like from my end on how I'm treating and what common treatments can be. Please like and subscribe. I'm still running every day, 365 days a year. You're going to see more outdoor videos than that, but I'm going to continue to post videos. The next one will be about meth, that's not that, about meth, meth withdrawal, as stated. The following is going to be about mental health and hormones, and from there you'll see videos, shorts every day still. Like and subscribe. I love every single one of you. I appreciate all the love and support. Have a great night. Have a great weekend coming up. I love you all, and I hope you had a good Memorial Day weekend.